Well, good morning. I'm King County Executive Dow Constantine. People who experience homelessness are not all the same, nor are the reasons for their lack of housing. To truly make a difference, to help people move off the streets and to translate the compassion of this community into effective action, we must address the root causes of homelessness. This we know. Homelessness is a symptom. It's a symptom of failures in the child welfare system, a symptom of persistent income inequality, a symptom of skyrocketing rents and home prices, and it is a symptom of the failure to adequately fund mental health and addiction services. Today, I am announcing a new partnership that will help us provide an open door and new hope to those seeking behavioral health treatment. While we will help people through the door when they need help, we will also need the ongoing help of the state and the federal government to ensure that we have full access to behavioral health services, services available to all, services of high quality. I'm also announcing funding for more treatment beds in Seattle, and we're going even further, funding programs that bring opioid treatment to people wherever they live. You know, everywhere I go, people want to talk about the tents, the tarps, the lean-tos in our cities, and in our neighborhoods, and even in our rural areas of King County. These all signal something wrong with our country. We see the rise in homelessness, and I know that everyone feels concerned. This is not inevitable. This cannot be accepted as normal. The causes of homelessness are society-wide issues, and they are challenges that can be reversed. It will take innovative thinking, it will take partnerships, it will take dedication to identify the upstream solutions where timely interventions can save lives. So first, under a partnership with Ballmer Group, who have been working with us to develop innovative pay-for-success models, approaches to delivery of services, and with third sector capital partners, we're increasing same-day access to behavioral health services for as many as 22,000 low-income people in King County. If someone in crisis comes to one of our 23 local treatment agencies, we will provide them help that day. That is our goal. No more take a number. No more we'll get back to you in a few days or a few weeks. With increased county funding and with the pay-for-success model, we aim to help every agency be able to help every person who comes to their door without delay. There's often a very narrow window to help people when they're in distress, people struggling with a mental health challenge or with addiction. We will provide timely assistance to take advantage of that precious moment, that moment of clarity when they reach out and say, I need help. I want to thank Connie Ballmer for her partnership and for being with us today. Second, I am also announcing that we will provide funding to reopen a facility here in Madison Valley owned by Pioneer Human Services to provide 20 more residential substance abuse treatment beds next year. This funding will help about 250 people annually receive treatment for addiction, help them make a new start in life. I want to acknowledge Karen Lee of Pioneer Human Services, who is with us here today. Third, to reach even more people where they are living, in urban areas and in rural areas, we are helping Evergreen Treatment Services purchase and staff a second mobile unit, a second van that provides medical treatment for opioid addiction in King County. This will get more help to more people faster than if we build a permanent treatment facility. Quite simply, It will save more lives now. Molly Carney of Evergreen Treatment Services is here, and I want to thank her for all that she and her agency do. We do these things and many others to meet the tremendous demand for ways out of mental illness, for ways out of substance abuse. Addressing the root causes of homelessness is like tackling climate change. There are many causes of climate change, but we need to recognize our responsibility to take on those causes so that we can avoid the results. We're here, there are many reasons why people experience homelessness. It is a symptom of many myriad causes. We must do more than provide a mat on the floor. We must tackle the root causes. We must fix multiple systems with determination and resolve. And we must form partnerships with organizations like Ballmer Group so that together as a community, we can meet the tremendous needs we see all around us. The announcements today are important first steps. There will be more as we turn our collective compassion into effective action. And it's now my pleasure to introduce to you Katrina Egner, who is Vice President of Sound Mental Health.
Good morning, everybody. My name is Katrina Egner. I'm the Chief Programs Officer and Vice President here at Sound. Welcome. First of all, I'd like to thank Executive Constantine and the Ballmer Group for bringing this issue to light today. Here at Sound, we provide services to about 22,000 people per year, and at any given time, about 500 people show up at one of our sites asking for behavioral health services, whether that's mental health treatment, substance use disorder services, housing, etc. We implemented treatment on demand in 2010, and it has been incredibly successful for us. We know that serving people when they need help, where they need help, is the first step to getting people in recovery, keeping them hopeful, and providing life-saving treatment. Being here together today with all of my colleagues shows that we have finally united, really as a community, to help those who need our help the most. Thank you very much.
And now it is my pleasure to introduce to you King County Council Member Jean Cole-Wells.
Thank you. Thank you very much, Executive Constantine. I'm very pleased to be here with you today. As chair of the Council's Health, Housing, and Human Services Committee, I've been working with my colleagues on the County Council to explore ways to improve access to behavioral health services, as well as to get at this really severe issue of homelessness in our county. I very much applaud this partnership that Executive Constantine has announced. I particularly thank Connie Ballmer and the Ballmer Group for joining with King County on a project that will truly open doors to treatment, which is what so many people who are caught up in a homelessness cycle really need. Today we are also announcing action steps to confront the heroin epidemic in our region, and this is so critical. We know that an enormous amount of individuals who are homeless or facing homelessness are suffering from heroin addiction or prescriptive opiate addiction leading into heroin addiction. And I had a nephew who died 14 months ago from a heroin overdose, not here, but in Minneapolis. And so we know what can happen on a very personal level as well. I'm also particularly excited about the introduction of launching a second mobile medical van for treatment services for opiate addiction. We have people who are homeless. We have people who are suffering from heroin addiction in our rural areas, also our suburban areas, not just downtown Seattle. And we need to make sure that they can get the treatment that will help them on their pathway to recovery. We'll be able to ramp up mobile services such that people are able to take advantage of this new program. And I look forward to the day where we have additional mobile vans than we are creating today. We need to do everything we can to create pathways to recovery. We all know individuals who are suffering, and we know the effects on families as well as our society from that horrible phenomenon. I expect the situation is going to get worse when we have fentanyl-laced heroin coming here, as it's already happening in British Columbia and elsewhere in Canada. So we need to take action now to forestall what could be an exacerbated situation in the near future. Thank you.
So I've already introduced a number of folks, and I also wanted to point out that Mark Putnam from All Home, Adrian Quinn, who's the director of our Department of Community and Human Services, are here to answer questions, as well as any of the rest of us I've mentioned, and we'd be glad to take whatever questions you might have. Go ahead.
Same-day treatment, is that a guarantee for folks who walk into any facilities, or is it a goal?
So the way this works is that we will be providing an incentive for each of these 23 agencies to get to the point where they can meet the goal of 80% of people getting treatment the day they show up. And in that way, because only about 5 of the 23 agencies right now are able to provide that level of service now, they will be paid the base rate regardless, but the county is able to put some additional money toward making sure that they have the incentive and the capacity to be able to get to that level, because we know it is dramatically more effective to give people treatment right then when they reach out for help. And we believe that, and this is the model that Ballmer Group has brought us, that's being administered or helped to manage by third sector. We believe that in doing this, we're going to get much more value out of the system, right? That we're able to help create more capacity and ultimately get more people moving through. There are about 22,000 people who can come into the system new each year. And if we're able, rather than having them seek help and then go away and wait and perhaps either lose interest or worse as the days and weeks go by, having them get on the road to recovery immediately is ultimately going to begin to turn the tide on homelessness as well as on behavioral health and addiction challenges. Go ahead and follow on.
Just how long do you expect that ramp up to 80%?
We're giving them 3 years to complete this, and if you don't make the cut, you don't get the funding. And that's our approach in our Veterans and Human Services levy work, as well as in our Best Starts for Kids work, that we are setting clear expectations. We're providing the funding to help you with your capacity, and if you are able to make the improvements, that is exactly what we want. And if you're not able to make the improvements, we have to move the money somewhere where we can get the best outcomes for the money available. Yes.
It strikes me that this is not something government can do alone. Can you speak to the importance of a public-private partnership?
I thank you for asking that question, because this is a critical thing for all of us in the community to internalize, that taking on homelessness, addiction, the mental health challenge, all of these things are community-wide challenges, and we have to do it collectively. So the government can do the things that government is good at, but the nonprofit sector, the private sector, the business community, individuals, religious organizations, we all need to have our place in this collective effort. That's the way we can overcome these really challenging issues. So the Ballmer Group is leading the way in helping us identify new, innovative, more entrepreneurial ways to turn the corner, to ramp up the quality and the capacity to take on some of these challenges collectively. Thank you for that.
Sir, some of the facilities that can handle the capacity, are they already in place?
So these are all existing nonprofit organizations who are providing services with public as well as, I assume, some private funding. And there are currently, I think, 5 of them that are able to, if you come there and you say, I need help with this addiction or mental health challenge, they're able to help you that day. The rest of them have a backlog. And what we're trying to do is help them reach the capacity and improve their practices so that they are also able to provide people treatment on demand. That is the key to recovery.
Now, I understand everybody works better with incentive, but if they already have the capacity, why aren't they already seeing these people?
So they also need additional funding to be able to increase their capacity, correct? And so it's not a mere incentive, it is also some of the extra funding they need to get the personnel or the other resources they need to be able to deliver that. And I would welcome our director or anyone else who's a subject matter expert here, as I'm now officially out of my depth. Go ahead.
Well, I just wanted to know, is there more jobs out there? I mean, with more capacity, more people coming in, the promise of turning them over 80%, you need more staff, I assume. So is this a job-creating thing also?
Thank you. Yes, Adrienne Quinn, Director of King County Department of Community and Human Services. One of the key things that the Ballmer Group and Third Sector helped the county with is figuring out precisely the right amount of the incentive in order to increase capacity. And so there will eventually be some additional jobs. However, as Executive Constantine mentioned, we really need the partnership of both the state and federal governments because the system has been underfunded for quite some time since the Great Recession. So we are hoping to add additional jobs, but we really need full partnership with the state and federal governments.
How do we put guards in place to make sure that people are not just getting shuttled through for that incentive? What's in place to keep people in check?
Absolutely. We continue to work on performance-based outcomes with all of our agencies here, and many of them can talk about some of the important performance-based outcomes in the way that they measure success for the individuals, because you're absolutely right, just measuring people walking in the door is not sufficient. So the county has also moved to a model called value-based payment in which we will pay for value. Some of these agencies here have already implemented that, including Sound Mental Health.
Thanks. Thank you. And I should just underscore one of these issues around federal and state funding. You know, especially in our region, it is very difficult to hire the already dedicated but qualified people to provide these services when the reimbursement rates are so low and the wages aren't keeping up with what it costs to live here. So we need to make sure, even as we're increasing the number of slots available, that we're also maintaining the funding to keep qualified people providing the services so that we can maintain the quality. Others, yes.
Sorry, just to follow up on the funding, it looks like it's coming from the mental illness and drug dependency sales tax. Can you just talk about whether or not that's going to shift money from other programs or just over those programs?
I cannot, but Adrienne can.
Thank you. So the mental illness and drug dependency tax was just renewed by the county council this last year, and so we went through a rigorous review process for it in order to make sure that what we were funding was achieving outcomes, and so this is part of that restructure for the MID.
So some programs will not receive funding anymore because they weren't performing as well?
Yes, for programs that were not as high performing, those programs will no longer receive funding. That is correct. Yes.
So for someone from one of the clinics to maybe answer this, what will this look like day to day, this change to this capacity? Someone can answer that.
So for us, for example, we've been doing this for almost 8 years now, and what it looks like is that in any given day, so this is how it works for us now, and this is how I would imagine it would work for other providers. On any given day in the morning, people come in, and we have intake assessors ready to see them. If perhaps more people come than we had intake assessors available, then we go find more people. We find people who had a no-show. We find people who had time on their hands, which is not often in our business, to be frank. And we make sure that people are seen. And the way the new incentive works also is that we have to bring them in the same day, which we're already doing. They have to have the intake done. And then we also have to show that there's service delivered. The first initial treatment is delivered within a few days after that. So it helps to make sure that people don't just get funneled through on an intake, but that they start receiving care. We always say it's much like if you went to a doctor and they said, well, yes, you have a broken leg, come back in 2 weeks and we'll fix it. That's not good enough for our community. So that's how it will look for most people. And in terms of tracking quality, what we do is we make sure that we take measurements when they first come in. We track that over time, how we think they're doing, how they think they're doing, and their level of satisfaction with our services. So that all goes into the value that we're then able to show outcomes to the state, to our partners, to the county, et cetera.
So is there a way to explain at your clinics specifically what this will mean for you? Will it mean more people on staff? Can you kind of give me an idea?
Yes, my vision for this is that this new incentive dollars will help us. Right now we do a lot of scrambling to get people in, so I think it helps bolster our infrastructure to make that less of a daily grind, really, to get the services delivered. Okay, thank you.
Yes.
This is probably for Molly. On the mobile services van, I know that you had some issues with communities not necessarily wanting those vans, and one was kind of sitting in the back of your treatment facility for a while. How will you work around that to have two in place and actually make sure they're utilized?
So I'm Molly Carney, Executive Director of Evergreen Treatment Services. It has been a challenge for us to find businesses or locations where we can put our van. The van that the county will be funding today actually provides ancillary services. So our existing van is a mobile dispensary. So we can drive the van to certain locations and dispense either methadone or buprenorphine, and in addition to Narcan kits, that overdose reversal drug. The second van will allow us to take a medical provider or a counselor on site with the van. We are required by federal and state laws to deliver counseling services for anyone who's enrolled in treatment with us. We've had tremendous challenges with the van just being the medication, helping people get connected with the medical provider or the counselor. So this van will allow us to have a completely mobile clinic. In terms of where we will park it, we are definitely going to need ongoing partnership with that. So the message that I have for those of you in this room and for everyone is that it's much better for all communities to have people engaged in treatment. So all of the communities in King County now have active opioid use disorders on their street corners, in their businesses, in your homes, and allowing us to park our vans for a limited period of time will allow us to engage people in treatment. So those folks will be at reduced risk for death and actually be able to move along the road for recovery. Thank you.
Well, sir, obviously this is something near and dear to your heart. I mean, I've been on quite a few of these press conferences, the fight against homelessness. Talk about how important this is to you, and basically the simple question, why do this?
You know, my job as county executive is to seek to ensure that every person living here has the opportunity to flourish and to fulfill their potential, and to contribute back to the community. And for a lot of our brothers and sisters, untreated mental health challenges, addiction challenges, PTSD upon returning from service, for example, are enormous barriers to overcome to being able to fulfill your potential. So here we are addressing not just the symptoms of those barriers in people's way. We're going to the root cause. We are doing what we can as a community, not just as a government, but collectively, to remove the barriers and let people move forward in really growing into a successful and happy life. That, I think, each of us would feel is a worthy investment of our collective effort and resources. Thanks, everybody.